advanced care planning is an opportunity for a healthcare professional working alongside people with dementia to spend time with them talking about their future care. The opportunity to advanced care plan with patients who are living with dementia is limited by the fact that they, at some point during their journey, won't meaningfully be able to contribute to that process.
There's many different options around advanced care planning, and that could be some legal things that need to be put in place, such as power of attorney, and decisions around whether people would still want treatment, and that could include do not resuscitate. And also thinking about what kind of death that somebody would like, where they would want to be, would they like sort of friends and family around them, but also some of the practical aspects around that as well. If somebody decides they want to die at home, some of those decisions require quite a lot of support around that. So it might be that you need nurses coming in 24 hours a day.
I think healthcare professionals may be hesitant to have advanced care planning conversations with people because they can be anxious about upsetting that person. I think time is a big issue. The better informed healthcare professionals are as to what's out there to support that person for the future, I think the more confidence that would give them.
I usually will meet with the person and their family a few times before we start having this discussion, because it can be difficult, and I want to sort of pre-warn them that we're going to talk about it first so that they don't feel bombarded with difficult questions, but also so that they can have a chance to really consider what's important to them. But I try and talk about the more positive aspects first, so talking about things that people want rather than what they don't want. Quite a lot of people say they'd prefer to remain in their own home or the place they call home, that might be a care home, and be cared for in the dying phases there.
I think with the advanced care plans, I think they are important for the basis of people can deteriorate and decline quite quick. So if we do hit a crisis point, that everything is there. Because I find when we don't have that stuff, it's quite a lot of chasing around and the wishes and expectations might not quite be met. Healthcare professionals, I think they can be a bit reluctant to approach due to not having the adequate training. I'd say it's good to network with other healthcare professionals who are regular at doing them, especially when you're first starting out, just to get a better understanding on how they'd approach it, because everyone does approach it differently, and it's about finding a way what works quite well for you.
The first point is when the people go to GP, they don't open up. In the Asian community, the dementia do not exist. What I picked up to advise people to go and do the Dementia Friends training, so they at least have the idea what dementia is. With the culture differences, it's just people don't accept it. So you have to just be patient. The best point is to just educate them.
I look after and care for my 99-year-old mum, who has Alzheimer's and dementia. It's heart-rending, it's joyous, it's difficult losing the person that's cared for you for many, many years, and now you're caring for them. At a visit to the GP, she saw I was coping on my own, so suggested then that I should get in touch with social services. I think healthcare professionals can support and help carers with proactively showing what services are available to people. Communication is just paramount.
Dementia is a life-limiting illness. It's a terminal illness. As healthcare professionals, we need to have the confidence to give people the opportunity to explore what their worries and their concerns are very early on, to help prepare them.
Take an opportunity, if you possibly can, to start that conversation, and don't think of it as having to have it all done in one go. It can be something that you build on.
If a time comes when somebody is unable to make decisions for themselves, we want to know, what do you like, what's important to you, how can we help you live as well as you can, and also how can we help you die as well as you can, how can we look after you where you want to be, with people who you want to be around you, and in the way that you would like to be cared for.